An inherited arrhythmic syndrome is when you have a mutation in an ion channel or a structural protein that leads to arrhythmias. And it's passed on from your father or your mother to your child. And that gets subsequently passed on as long as the mutation is passed on to the subsequent generation. So the mutation is a pathologic mutation when it results in an arrhythmia. Channelopathies are the full manifestation of that mutation in the ion channel. So ion channels are essential to maintain the heart's normal rhythm. When you have a mutation that affects its function, it can lead to arrhythmias by destabilizing the electrical activity of that heart muscle. The other way it can act is by affecting the ability of the heart muscle to function normally, which can create scarring of the heart muscle, whether that is overt or whether that is sort of a subclinical level of scarring. Those are some of the possibilities that can lead to arrhythmias. So either it's affecting its electrical function directly, or it's leading to some level of structural alteration that can also lead to arrhythmias. The big question is, when somebody's heart looks totally healthy, how do we know, how do we predict when somebody will have a lethal arrhythmia and die suddenly? And unfortunately, most of the information that we have is based on these sort of anecdotal studies where we look and see, well, who died and what were the predictors of those deaths. Certain arrhythmias do leave telltale signs. Some of them have EKG changes, such as Brugada syndrome, where the very diagnosis of the disease has a very characteristic appearance of the EKG. And without that characteristic appearance, you cannot call it Brugada syndrome, where they have a very abnormal EKG that is a very is diagnostic for the disease. Other arrhythmic conditions really have completely normal-looking EKGs, so you can't even tell based on looking at the EKG that they even have an arrhythmic disease unless they're provoked in some way. So arrhythmias are very common, and arrhythmias can be benign or they can be malignant, meaning that they can lead to lethal consequences. So arrhythmias are a huge problem in developed countries as well as non-developed countries. The treatment for the non-lethal varieties, I mean, there are many different treatments, that whether they include drug therapies or ablative therapies. These therapies exist widely for these arrhythmias. But the big question is, well, what about the lethal varieties, and how do we treat those? We generally treat those with something called a defibrillator. And when you first manifest with the disease, the vast majority of patients typically have either coronary disease or some level of structural heart disease. So that is the main driver of lethal arrhythmias in developed countries. The channelopathies that we were discussing before, which are the inherited varieties, those patients can have completely pristine structural hearts that we can't detect based on standard imaging studies. Those patients are rare, but they still constitute a very significant burden of lethal arrhythmias in the country. And so the challenge for us as electrophysiologists, both clinically and in the basic lab, is, well, how do we risk stratify these people, and then how do we identify them, and then how do we get to the molecular level where we can genetically identify what the mutation is that's causing the disease.